Hi, everybody. So today we are so excited. We have a guest. We're going to introduce her. This is our first time, so we're excited. We're nervous, but I hope everyone had a beautiful Christmas.
Well, this is technically coming out well after Christmas.
It's true.
So I hope everyone had a great new year and first week or so of the new year as well.
Yeah.
But we are so excited. So we are going to be introducing a physical therapist. Her name is Amaya. She owns her own
Practice. She specializes in pelvic floor therapy, which is amazing for the girlies, but she also talks about some for the men.
So
And
don't discredit this podcast episode if you're one of our boys that listened in, and we love you and cherish you for that. This is also a podcast episode for you, and it's for everyone. She's amazing.
I can also see a lot of the women being like, oh, my husband needs that, or my boyfriend.
Yeah, or like listening for this. Yes. We're just so excited.
And here we go.
Welcome to the Soon Podcast.
Hi, everybody, and welcome back to the Soon Podcast. My name is Alyssa. I'm a functional health practitioner.
I'm Amandalyn, and I'm a style curator and buyer.
And today we actually have our first guest. We're so excited. This is Amaya, and she is a pelvic floor therapist?
Physical therapist.
Yes.
Nice. Perfect. And you work at Ortho Pelvic Physical Therapy, right?
Yep. I'm the newest owner of Ortho Pelvic Physical Therapy. I
Amazing.
inherited the practice in early April, and it's been going really great.
Oh my gosh,
Amazing.
that's so cool. Well, tell us a little bit about yourself.
Yeah, I want
Yeah.
to hear a little bit about you and how you got into this business and just all the things.
So since I was a little girl, I wanted to work in women's health. I really thought that I wanted to be an OBGYN, and then I made it to like my sophomore year of college, and I was like, I don't want it bad enough to go to med school and then do a residency for like 6 years. I don't want to do that. So I was like, okay, what am I going to do instead? But I didn't really make that decision until almost the end of my junior year. And my advisor was like, well, you're not dropping out of biology. So figure it out. So I shadowed with an occupational therapist, but I was just always watching the physical therapist. And then COVID hit. So I was on TikTok and I learned about pelvic PT. And I was like, oh my gosh, it's meant to be. This is what I'm supposed to do. I did an accelerated hybrid program through South College, Knoxville, and immediately went into pelvic PT after graduating. So this is the only specialty that I've done, with the exception of a little bit of peds, a little bit of general ortho, but I absolutely love
Wow.
it. And then like upon graduating, I had some of my own pelvic dysfunction. So that's why I really love treating pelvic pain and letting women know that like you're not crazy, because your OB/GYN will sometimes gaslight you and they're like, nothing's wrong. All of the tests are negative. And you're like, well, I still feel like I'm on fire. So something is obviously not right here. And I went through that for like a year before I was like, okay, this is what's actually going on.
Oh my gosh, I love
Wow.
that. I love that you kind of found your niche and then you stuck with it, even if it was off the path of what you were originally going for. I just think that that's amazing. So, congrats to you. That's fantastic. I love that.
Yeah,
Thank
I feel like
you.
that's one thing I've learned, like going into my 30s. I'm like, none of us have this figured out. Everything that we think was going to be our path can change, and it's always for the better,
Yeah.
which is really cool. And I love that you did that, but aren't those accelerated programs really hard?
It was absolutely insane. Like,
Yeah.
even talking to people now that I went through the program with, everybody's like, do you really remember those 2 years? And all of us are like, I remember bits and pieces of it, but I know that I learned a lot of things because I go
Yeah.
to work every day and I know what I'm doing. But like, you really have to buckle down, because we had exams, at least one exam every single Friday, the whole time that we
Wow.
were through the program, until we were just doing clinicals. And most PT programs are 3 years. We got it done in 2. So it was a lot. But we had some of the best professors in the country that are like leaders in their fields, own their own practices, own multiple practices, teach continuing ed, all of those things. So I felt like we got a super great opportunity. And as long as you can lock in, like you're good. But if you're
Yeah,
somebody that's not like a self-starter, a hybrid accelerated program is not going to do well for you. And with
sure.
it being COVID times, I was like, I think this is a better decision than going to a school that's kind of like trying to figure out how to do online versus a school that has always
Mhm.
been primarily online. So they knew what they were doing. The only thing that changed was, are we going to lab or are the numbers too high? And are we going to have to do lab virtually, which was weird, but we still figured it out. So
Wow, that's actually really smart to do like
Yeah.
a program that was already online and
Yeah, smart, because
they
I
had
feel
it
like
figured out.
it was such a weird time where everyone was like, "We'll just give it a spin virtually," and not knowing. So that's so smart and awesome. I mean,
Yeah.
how cool.
So how long have you been doing this then?
So I graduated PT school December of 2022. So
Oh,
this is my 3rd year officially, which is
wow.
insane to be like, you're 3 years out of school and you own a practice now, like, and
Ah,
this Ortho Pelvic is a practice that I followed even when I was in school. So, like, I was like, "Oh my gosh, like, they're doing such great things. They treat men and
mhm,
women, and they see kids sometimes too. Like, this is so cool. They're really, like, taking care of everybody's pelvic health and not just women." Because I think
right.
people forget that, like, we all have pelvic floors. Your partner has a pelvic floor, your child has a pelvic floor, and, like, everybody's pelvic floor does need support too. So I think that's one of the things that makes our clinic unique is, like, we will see everybody that comes in, whereas, like, a lot of pelvic PTs aren't comfortable seeing men, but there's so many that need help, like, post-prostatectomy, they definitely need it because 'cause they'll have issues with leakage because the radiation, like, really kills their muscles. So,
Wow. Yeah, I
yeah.
didn't even know men were like a thing in this realm.
Well, I feel
So,
like that is a good lead into our first question, which is for those of us out here, kind of like myself, who are not in the health and wellness industry. Can you tell us a little bit more about what is the pelvic floor and give us a little bit more insight on that?
Yeah. So our pelvic floor is made up of over 20 muscles. I have a
Woo!
little
This
model
is
right here.
amazing.
So this is our pelvic floor. It comes in 3 different layers. And as you can see, it's like almost like a little hammock and it holds up our rectum, our uterus, and then our bladder sits right here. So a lot of the things that people will come in for are issues with like leakage or like feeling heaviness or pain. I would say those are like the main issues, but I tell everybody like anything that's bowel, bladder, or sexual function is pelvic floor related because our pelvic floor works very closely with our abdominals, with our low back, and with our hips. On this model, you can even see like some of these muscles are technically hip rotators, but because of where they sit in our pelvic floor, they coordinate with all of these muscles. So we kind of
Interesting.
lump them in together. So I'll also see patients that have had sciatica or hip pain for years, and they're like, I've been to PT, I've been to a chiropractor, it's not getting any better. And then we'll do an internal exam, and I'm like, it's because they can't reach these muscles as effectively from the outside. And while, yes, you do have an issue with your hip rotators, you also have an issue with your pelvic floor just clenching so much
wow.
that it's irritating the nerves and you're not getting enough blood supply either. And then you have pain.
Yeah. So
That's
even
so
though
interesting.
men don't have a uterus, they do have those other muscles and issues that are related to the pelvic floor as
Mhm.
well.
And, like, the male model is actually really cool because, on this one, you can see that it makes sense that men have a lot of issues with, like, erectile dysfunction and things like that if they have a really tight pelvic floor, because you can see that, like, the muscle layer goes right through, like, their urethra runs right here, and then their prostate is also right here. So if they have a large prostate, it's gonna be pressing onto their pelvic floor, and that's more stress that it has to hold up. And then, they can have issues with, like, not feeling like they can completely empty their bladder, or if these muscles are also, oh my gosh, super tight, then you're not getting enough blood supply. And like the 2 biggest things that you need to have an erection are nerve input and blood supply to your penis. So if that's not happening, then you can't achieve or sustain an erection. So we'll see people for that a lot too. I would say that's one of the biggest reasons that we'll see men because they're like, if my penis doesn't work, this is not going to work for me. We need to figure this out.
That's crazy.
So crazy. I just feel like there were so many things that you just said in one sitting that I'm like, I had no idea. And I also love hearing you talk.
Yes.
I
It's
know.
it's literally my favorite thing to talk about, so when you guys sent me some of the questions, I was like, "Oh my gosh, these are my
Say
favorite
less.
questions." I, like, go on dates and I'm like, "Do you wanna hear about your" they'll ask me what I do, and a lot of times on dating apps, they think that, like, I'm kidding around or it's code for something, and I'm like, "No, like, this is, like, my actual job is to make sure
Yeah.
that people can, like, pee, poop, and have intercourse the way that they want to." And they're like, "Oh, that's actually really cool." Some
Yeah.
people are like, "Wow, you, like, treat men too?" And I'm like, "It's not weird, though." Like,
Yeah.
it's so, like, medical that I'm like, I've never had a problem with anybody, and a lot of people say that in our clinic especially, they're like, "I feel so at ease because you guys, like, turn the lights down a little bit when we come in and, like, there's music playing," and, like, we try to talk to them about other things because
Right.
especially with our pain patients, when they're so focused on, like, what we're doing
Mhm.
internally, it, like, really spikes their anxiety, and when you're anxious, things just tense up a little bit more and want to
Right.
guard. So I'm like, "I need you to relax." And then it also tells me a little bit about their relationships too, because 'cause I'll ask them questions about their partners, and you can kind of see sometimes they'll, like, instinctually, like, just guard a little bit. So I'm like, "Okay, this might be something else that we'll deal with down the line, or it'll be a referral out," because there's a lot of, like, psychological things that go into it as well. Because
Mhm.
most people are like, "I want to, like, connect with my partner. It's not that I don't want to have sex with you, like, I can't figure out
Right.
what's going on with my body and why this keeps happening."
Yeah, those
That's true.
are all very vulnerable aspects of our life. So, with that being said, what does a first pelvic floor appointment look like usually?
Yeah.
Is it awkward? Is it a little uncomfy? What do we have to expect?
Yeah.
Yeah. So I would say it's different everywhere you go, but standard is like you'll come in to whatever clinic you're going to, and your provider is going to take you either to the side somewhere, or in our clinic, we'll take you back into a private room to go talk to us. And we're just going to ask you a lot of things about your life to start off. So we want to know, like, what kinds of things you're drinking, what's like your biggest issue. And like people that have a lot of issues, which is usually most people that end up in pelvic PT, I'll have them like prioritize, like, their top 3 problems, and we'll, like, really dig into those. We'll talk about previous history, so it'll feel just like a normal doctor's visit. From there,
Mhm.
I'll ask them if they want to do internal or not. Sometimes we will get patients that are like, "No, I don't wanna do that." But for the most part, everybody does wanna do it on their first visit because they wanna know what's going on.
Right.
We'll start with me assessing their abdomen because, like I said, like, if we have a lot of tension in our core, usually our pelvic floor is also really squeezing, and because of pressure dynamics, I need your stomach to be relaxed. So I actually tell a lot of women, I'm like, "I need you to stop sucking in, relax your belly," and
Mhm.
they're like, "It is relaxed," and I'm like, "No, this isn't relaxed." And then when they, like, feel what relax actually is, they're like, "Oh, I've been, like, clenching my abs, like, my whole life,"
Oh my
and
gosh.
when we do that, we can't manage pressure, so all of that pressure goes straight down into our pelvic floor, which can cause other issues. So after I assess their abdomen and get a little bit of a release in there, I'll look at their inner thighs because they attach all the way up onto our pubic bone, so they can also be pulling and causing problems. And because our superficial layer of our pelvic floor is, like, literally our labia and everything, all of that's interconnected. So people that are having, like, high groin pain, all of that, I can learn a lot about what else is going on. And especially if somebody doesn't want to do internal, that's a way for me to get some more information.
Right.
And I can assess externally, like if they can contract, if they can squeeze. I just won't have the best idea of strength.
Mhm.
From there, we'll move to internal. I start shallow and then slowly we'll work until I'm in that third layer where I can feel all of their hip rotators and everything like that. And I'm talking to them throughout the whole time about what I'm finding and what we're going to do. And anything that I find along the way, I'm starting to treat it that day. So that's a
Oh.
little bit of a different thing here. Some places will just do their evaluation and then start treating on the second visit. But I'm like, I'm
Mhm.
already here. I know that you're, like, a little bit nervous already, so let's go ahead and at least make you feel better before you go home, and then we sit down and talk about what the plan is and a little bit of homework, maybe 1 or 2 things. Usually, that's looking like stretching and breathing for their first piece, and we break our treatment into, like, 3 different, silos, I would say. So we start with lengthening the muscles because if you have a tight muscle, it can't do anything. It can't
Mhm.
coordinate with your other muscles. You can't really relax to work through that full range, and it also doesn't give you a true description of what their strength actually is,
Mhm.
because if your muscle is super tight, it's not gonna have the full force to produce the contraction. So you'll seem weaker than you actually are. So that's
Mhm.
why we have to lengthen the muscles first so then I can see what your true strength is. And then we work on coordinating. And then after we do the coordination, I'm like pushing you as hard as you can to make sure that you never have these problems again. So for my leakage people, that's like, we're going to go jump on the trampoline or we're going to run on the treadmill and like all of these things that they're afraid of that they're like, that's when I always leak before. I don't want to do that. And I'm like,
Mhm.
I promise you, we can do this. Cause at that point, they're like, 10, 12 weeks into treatment and about to discharge. I'm like, I need to know that, like, no matter
Right.
what you do, this problem's not gonna come back.
Wow.
And
That.
so they really appreciate that because we get a lot of women that are like, I wanna run with my kids. I wanna be able to go to burn boot camp and not worry about, like, am I gonna pee myself if we do jumping jacks today? Like, no, we don't have to live like that.
Yeah.
No, that makes total sense. I love that. So, with that, what conditions or symptoms do you most commonly treat when
Mhm.
people come in?
Yeah, so I would say it ebbs and flows. Leakage is probably always going to be our number one. And then after that would be like pregnancy, postpartum. I would put them in one bucket together. And then pain, which can look like pain with intercourse, endometriosis, fibroids, all of those things. And
Mhm.
then I would put our male patients just in a category of their own. And usually they're either coming in for some kind of sexual dysfunction or they have some prostate stuff going on. So that's like
Mhm.
the two biggest things that men are coming on for.
Okay. And then are there some things that you're like, these people never come into us, but they should come in to see us? Like, you're like,
Yes.
I'm so glad you're here because most of you guys don't come in to see us. Are there
Yeah.
some people like that?
Yeah, so I just like treated my massage therapist recently. She had a 360 tummy tuck, and I'm a big advocate of like if you're having any abdominal surgery, you need to be coming to pelvic PT after. And it might not be a full stint, it might just be for a little bit. But like she had her surgery 4 years ago, and she's like, I still
Um,
feel like I'm so snatched that I can't like take a full breath into my belly. I like get really uncomfortable after I eat. Like I'm always having hip pain and back pain and everything. And we did maybe 3 manual appointments of me really doing lymphatic drainage and working through her belly to get everything to relax. And I saw her maybe 2 weeks ago. She's one lost like 14 pounds from like the inflammation and like the lymphatic flow being so much better. But also she's like, no, I don't have any pain anymore. I can work all day and like my hips aren't hurting. I've been able to like she went, I think, to Yellowstone with her family for like Thanksgiving and like they were hiking all over the place and she's like, "No, I was fine the whole day. Like
Mm.
I'm good." And I'm like,
Oh
"This is
my
so great.
gosh.
I'm so excited." So, we'll see people for stuff like that too, and that's not something that people are usually thinking, "Oh, I should go to pelvic PT for this."
Totally. How
yeah.
fulfilling,
Mhm.
honestly, to see that transformation happen. That's
Yes, like,
amazing.
my favorite thing is just, like, seeing patients get well, and, like, my favorite thing to hear is, like, "I'm doing great, I actually don't need the rest of my sessions," and, like, they'll decide what they do from there for her, like, her husband was already coming to us for, some other stuff, so she was like, "I'm just gonna give them to him," but then we do, like, packages and have lots of, like, freebie sessions in there, so you'll be able to see our personal trainer, and she was like, "I wanna give my personal training session to one of my friends, can I do that?" And I'm like, "Of course." So, we'll do all kinds of stuff like that too.
That's awesome.
That is really cool. I've
Yeah.
worked with a few physical therapists. I was a PT assistant for like a small portion of my career and I loved it. It's really cool because with physical therapy, you can actually see people improve.
Yes.
Oh, I love that, and yeah, I also went on, like, a trip, a medical mission, and
Mhm,
we had a neuro PT or something of that sort, and
mhm.
she was literally helping babies who had never, like, crawling or stand up, and she was helping them do that in one session, and it's just wild to see the improvement. But also, it is crazy that, as women, we are always like sucking in. Like, I don't know how I made it through high school. I probably had no air going to my
Like
brain
the
because
pants
I was
that we
just
used to
sucking
wear
in.
when
The
sitting
super
down
skinnies.
all day long too. I would come home from work with like marks from the jeans that I was wearing. And now I'm like, I would never wear
I
those. Like,
know.
that's
Now
crazy.
I'm like elastic.
So, that's true. We are big elastic girls. But that is interesting. Do you think that stress, anxiety, breath holding, any of that fun stuff that women do all the time to make themselves feel better. Do you think that that has any effects on the pelvic floor?
It 100% does. Like, I know that, like, for me, my, like, pelvic diagnosis and everything was 100% triggered by stress. So, just like a lot of people hold tension in their upper traps and some people will, like, grind their teeth when they're
Mhm.
stressed, people will clench their pelvic floor when they're stressed. And when
Mm.
those muscles start to clench, they irritate the nerves and you'll start to have pain. Or you might feel like you have a lot of urgency when you start to get anxious because you're now putting pressure on your urethra and it's like, oh, I need to pee. And then you'll go and just a little bit comes out and you're like, I didn't actually need to be in here. And it's
Oh,
because your body was sending you that signal, but it wasn't a
Yeah,
true
wait a minute.
indication of I need to use the bathroom right now. And then with the breath holding, I would say that comes in play a lot, especially if you're lifting things that are heavy, because if you're holding your breath, especially on the hardest part of the movement, that pressure has to go somewhere. And if you're it's either going to go out into your abs. And if you have a weak core or a separation postpartum, that's not really helping your diastasis recti, or it's going to push down into your pelvic floor. And that's why some people will leak if they lift really heavy or they'll have pain. So there's a lot of different things, or they'll have like symptoms of their prolapse and feel like something is falling out. I don't like that feeling. I don't want to do this anymore.
Mhm.
So there's a lot of different things that can happen because of the pressure management. So I tell everybody like the easiest thing that you can do to help protect your pelvic floor is try to remind yourself to exhale on exertion. So if you're
Mm.
doing a squat, that's going to be when you're coming up is when you're blowing out like you're blowing into a straw to just get rid of some of that pressure and making sure that you're truly lifting your pelvic floor. And I tell people to think of like zipping up their core or even like closing a corset and bringing everything together is how we're going to brace our core.
interesting.
Yeah, I was gonna ask about that
Oh.
because, sorry, as like I weight lift and they usually say to take a deep breath in, like in your belly,
Hmm.
before you do a squat
Hmm.
to kind of brace yourself. And then you squat. And then when you stand up, you exhale, like you were saying. But do you think that's the correct way to kind of brace yourself?
So when I like am first teaching people, I'll tell them to inhale as they're going down and exhale and engage everything as they come back up. The other option is to inhale to prepare and then exhale as soon as you start the movement, but doing that
Mm.
long exhale until you're all the way back at the top. Not
Um,
everybody has like the lung capacity to do that. And it's definitely a learned skill, but it's something that everybody can learn eventually, especially once you're higher level. I know that weightlifting belts are also really popular, especially once you get higher in weight and everything. And they can be a really good tool as well to remind you to brace your core. But some people are actually like pushing into their belt, and that's not what we want. We just want it to be like that
Mm.
tactile cue to remind you, oh, my belly's out, let me pull everything back in and up. So, like, another simple exercise that I'll give people at home to, like, figure out if they're bracing their core correctly or not is I'll take them into the mirror and I'm telling them, "Hey, I want you to watch your belly button, and when you brace your core, it should come in and maybe just a little bit up, but you shouldn't see your belly, like, pooch down when you're trying to brace your core. If you are, then you're using a lot of your rectus and not so much of your transverse abdominis, which is that deep corset level of your core." And usually
I'm
people will
scared.
feel
I
that.
know we're gonna have to do that after
Yeah.
this. Yeah.
And usually you'll feel like a seat belt almost across your waist if you're, like, truly engaging your core correctly. So another cue that I might say is like, "Hey, make those, like, 2 hip bones in the front kiss." They're not actually gonna move, but if
Yeah.
you're visualizing them coming together, that's another way to kind of help you feel that.
Wow.
Awesome. Well, okay, I know how you mentioned that when people get anxiety, sometimes they'll feel pressure. So I was wondering if you have any tips for that because I mean, I'm speaking personally here for both of us, to be honest. When Alyssa and I are about to get on a plane ride, do something that gives us any sort of anxiety, we are in the bathroom like 6 times. I'm like, let me go one more time just in case and I don't have to go at
Mhm.
all. But it's just
Yeah.
that pressure. And I've never been able to figure out how to
I think it is a lot of anxiety too,
Yeah.
which is, so
Interesting.
how can you trust yourself? What do you think?
Any
Mhm.
tips?
Yeah.
Yeah, so I have actually like a few different tips. So like if you're at home, I tell everybody I'm like, do not just in case pee. Like we know that it takes 2 to 4 hours for our bladder to fully be full. But when you're just in case peeing, you're teaching your nervous system, oh, I need to pee every 30 minutes or every time that I leave the house or every time I get home and I'm at the door, I need to like go to the bathroom. So people will start to get like lock and key syndrome is what we call it, where like as soon as they're at the door, they're like, I have to pee right now. And
Mm.
then they get into the bathroom, they're like, I didn't really need to pee.
That's
So
Mhm.
the best thing that you can do is take a breath and calm yourself down. Sometimes I'll tell people to sit down and then taking your feet on the floor and doing a few little calf raises can be really helpful because the nerves that innervate our calves also innervate our pelvic floor. So we're distracting our brain a little bit. Another thing that you can do is when you do go to the bathroom, doing those big, deep belly breaths and trying to picture your pelvic floor like opening up almost like a flower. Because when our pelvic floor is opened and we're completely emptying, then you shouldn't have more urgency after you've gone to the bathroom. I'll
oh,
also do like little like hip swivels on the toilet to reposition my bladder to see if that helps. And if you're like, I cannot go to the bathroom, but I'm having some urgency right now, you can cup your bladder and just lift it up. So I like to take my hands like this and just scoop upward towards my belly button.
Wow.
And that takes some of the pressure off because our bladder truly does sit right on our pubic bone almost. Oh my gosh, there we go. So when we lift it up some, then it's not so much pressure on our pelvic floor.
that's
Wow.
so interesting and helpful.
Yes.
We'll be
Um,
using those tips.
and then if you're like anxious, I would tell people to do like legs up the wall or even like happy baby on the wall. So like I have panic attacks sometimes and like I'll do legs up the wall or I'll like hang over the side of my bed because
Mhm.
your heart has to pump harder when you're like inverted like that to get the blood flow back up. So either legs up the wall or hanging upside down can just help slow things down a little bit and just focusing on the breathing. So those are
Awesome.
other things, not necessarily good in the airport, but some options.
No,
We'll
that's
do it.
so helpful. Yeah, well, if you see us doing happy baby in the airport, just look the other way.
I've done weirder things in the airport.
It's a
And
safe space.
do you recommend a similar approach for people like struggling with constipation? And I work a lot with people with that issue, and a lot is, diet, exercise, fiber, all of those things. But I also am like, how long are you giving yourself on the toilet? Is it like 1 minute and you're like, oh, I gotta go and now I'm constipated? And I'm like, did you, sit and really exhale? And sometimes I even recommend those hip squiggles, like you were saying, like, just to bring awareness to that area. But what do you recommend? Is that the wrong approach?
I wouldn't say that it's the wrong approach. My like number one thing that I always recommend first, like line of defense with constipation patients is going to be abdominal massage, like an I love you massage, or even just like circles on their belly to help stimulate that peristalsis so things can move. And then
Mhm.
also a squatty potty if they're really having trouble with that exiting, because when your hips are lower than your knees are, so knees are above hips, your pelvic floor is in a position where things can open up more, and
Mhm.
then you can evacuate your feces a little bit easier. It also helps if you're someone that's like going to the bathroom like multiple times or having a lot of urge because same muscles are opening up. So you can make sure, like, okay, my bladder is completely empty. And you can get some really cute squatty potties off of Amazon for like
Yeah.
$20. I know in our clinic, we just bought a bunch off of Alibaba at one point. So we have a bunch of them and we just hand them out for free to patients.
Oh,
So I'm
smart.
like, literally, there's no reason for you not to do your homework because I'm giving you all of the tools to do them. But the
Love that.
breathing is another big one because a lot of people are like holding and then trying to push down,
Mhm.
which is not going to help. You're going to be at risk of like hemorrhoids, fissures, all of those things. So I'm like, I don't want you to push. Like, you should be able to kind of just breathe your poop out or it should just slide out. And if
Mhm.
you're sitting on the toilet for 10, 15, 20 minutes, get up, nothing's gonna happen. I say, like, give yourself a good, like, 5 or so minutes. If nothing's
Okay.
happening, it's not quite ready yet, go ahead and get up, go about your day, move around some, come back when you get the urge again. But we don't want to ignore the urge because then it's like gonna go back up into our colon and it gets even more dry and hard and crusty. And that's what
Mm.
we see with a lot of our child patients that we treat is like they'll end up in that loop of like, I don't want to poop because it hurts. And then they don't go. And then it hurts more because it's so dry. And I'm like, okay, we have to use the bathroom, bud. Like we
Yeah,
have to
that's
go. Yeah.
that's tough. No, that's helpful though. I feel like that's all good advice and simple advice, to be
Yeah.
honest. Yeah, which
Yeah.
is even better. Okay, I have a question that I think that a lot of people will like to know the answer to. So,
Mhm.
what are some common myths or misconceptions about pelvic floor health? Kind of thinking like everyone's always said, like, just do Kegels. Are those the answer? What are your thoughts?
I'm not gonna say Kegels are never the answer, but they're very rarely the answer in the way that people think that it
Wow.
is. So, like I said earlier, like, most people are told by their OB, like, "Oh, your pelvic floor is weak. That's why you're leaking." But then they'll come in to see me, and I'm like, "No, it's tight. That's why we're leaking, and it, like, seems counterintuitive, but if you think of, like, a straw that you were, like, drinking out of and then you grabbed it, there's gonna still be some in there, so then if you get up and start moving around, a little bit might come out, or if you, like, cough really hard, that's a lot of pressure, and then a little bit more is gonna come out because it's just kinda sitting in your urethra because you weren't completely emptying to begin with because things were so
Ah,
tight. So I
interesting.
think when I explain it like that, people are like, "Oh, that makes a lot of sense now." Because they're like, "I go to the gym, I lift, I'm doing all of these things that my doctor's telling me I'm supposed to be doing to be strong and live a healthy life. I don't understand why my pelvic floor would be weak."
Mm.
So usually it's not actually truly weak. It's really tight. And that's when we need to open up. And part of that is also our lifestyle. Like we sit a lot as Americans,
Yeah.
so our hips get really tight, and like I said earlier, like our hip muscles are in our pelvic floor, a lot of them, or they coordinate with our pelvic floor, so things just get really tight and need to be opened up.
Mhm.
So I tell people like stretching, even if it's like I'm just gonna do 5 minutes of like a hip mobility yoga type thing, is gonna be helpful for you. Or getting up once an hour to like stand at your desk, whether rather than sitting your whole day is gonna be helpful for you.
Mhm. Wow, that's awesome
Yeah, that
to
is
think about.
helpful.
Yeah, because the Kegels are to help tighten things,
Mhm.
strengthen, but yeah, maybe we really just need to relax more
Mhm.
and yeah, have that mind body connection. So that's super interesting.
Yeah.
And I will also say I'm a doula, a birth doula,
Mhm.
and my first intro with pelvic floor physical therapy was I was hired by one to be her doula.
Mhm.
And she was amazing and she had a lot of awesome insight and she didn't have any tearing, she had no issues, and I have a couple, like, questions about that. So, one thing is, purple pushing is a big thing, so for anyone who doesn't know, if you're gonna go have a baby, a lot of the nurses and doctors, they will say, "Okay, take a deep breath in, and then we're gonna push for 10 seconds," and they will count down, and 10 seconds is a long time, and sometimes it can be for an hour, 2 hours, 3 hours of pushing, so you can imagine, like, your face getting purple.
Mhm.
So that's called purple pushing, and this client was like, "I will not be doing that."
Mhm.
And she actually was breathing out, I believe, while she was pushing.
Mhm.
And so, can you tell us, do you have any experience with that or what you tell your clients who are pregnant and what they should do when they're at the hospital and all of these doctors are like, this baby's not coming out because you're not pushing."
So we have, like I think it's, like, 16 pages, our birth prep packet that we give to
Wow.
patients, and honestly, it's more so for their partner than them because, like, they learn all of that from coming to see us week to week, but partners don't always come to their appointments, and they can
Uh-huh.
also be very anxious about, like, "What can I be doing to even help you?" But with the purple pushing, it's almost like when I was talking about, like, trying to have a poop and bearing down.
Yes.
So if baby's not far enough down and we're just pushing, 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 we're not gonna see anything productive. So when I hear people are, like, pushing for 3, 4, 5 hours, I'm like, you shouldn't have been pushing that long to begin with. They had you pushing before you were physiologically ready to push.
Mm,
Just because you're at 10 centimeters doesn't mean that baby's ready yet.
mm,
So, like, that can be a part of it. And then with, like, letting go of the pressure, I'm also thinking about, like, opening up my pelvic floor. So I tell people, "Hey," when they're saying push, what they really mean is lengthen. Like, that's the word that we always use
mm,
in therapy is, like, you want to lengthen your muscles. So letting the muscles open up so baby can come out, because what's actually pushing is your uterus. That's what pushes baby out, not your pelvic floor. Your pelvic floor needs to get out of the way, and that's how you avoid the tearing. I also, like, highly encourage my patients to do perineal massage starting at 32, 34 weeks. And I tell them, like, as often as you can is going to be helpful. But at that point, they're coming in to see me every single week. So I know at least for 45 minutes, 30 minutes a week with me, they'll get it done.
mm,
And then hopefully a few more times at home. And I'll encourage the partner, like, hey, come in so you can learn how to do this too, because it's hard to reach even with a wand once you're 34 weeks, like, your belly's just really big. So,
mhm.
so those are the 2 big things that I'll tell people, and then also, like, using gravity to your advantage and trying different positions. Like, I also highly encourage people, I'm like, giving birth on your back doesn't make any sense biomechanically,
Mm.
because you'll also end up potentially with tailbone injuries, because your tailbone can't now move and your sacrum
Yes.
also can now not move if you're laying on your back.
Mm,
So, if you're thinking about getting an epidural, I'll be like, most doctors will let you move as you please around the confines of the bed, but if you're nervous about that, or they're like, "No, you can't do hands and knees with your epidural," you can always still do side lying, and then that allows your sacrum to move out of the way so that you don't have a
yes.
tailbone injury and open everything up a little bit more, and then you also have some more play with what you can do with that top hip, whether that's, like, rotating into internal rotation so that things can open up at the bottom, or rotating into external rotation, which you wouldn't really be doing as baby's, like, already down. But we talk a lot about, like, what your hips are supposed to be doing at different stages of birth. That way, you know, like, okay, this is going to help baby right now rather than hindering me. And then also standing up for yourself, which, like, it's already a stressful time, but either having somebody in the room like a doula, or your partner being knowing what your plan is and advocating for you, and, like, being like, "I'm not gonna do that,"
Yeah.
or, "This is how I want to try to do this first," or, "I'm not ready to push."
Yeah.
Right.
It feels so intense in those moments.
Mhm,
And when they're like, okay, you're 10 centimeters. And
mhm,
a lot of the times as a doula, my job is to just be like, nothing has changed in the last minute. Okay. You're told this is 10 centimeters, but we have time. We can like discuss what we want to do.
mhm,
We can get you into a position. Like nothing has to be like bing, bang, boom. Like,
mhm.
so
Yeah.
I think
Baby's
that's,
not in distress, like, we have time, and,
yes.
like, baby's gonna come when baby's ready. We can't force them to be ready, and we see a lot of these, like, severe tears when
Yes.
people are, like, either forcing it, or when things aren't in your hands or in your control and baby just comes really fast and your tissues just don't have the time to expand, to
Mhm.
get out of the way.
Totally. And just with that being said, one thing that this woman was telling me was, I wish more women would come in to see me while they're pregnant or even
Mhm,
before they're pregnant and not just postpartum.
Mm.
mhm.
And so, what are some ways that you help these women? And should we come in even before we're even pregnant to just get things assessed? Like, what do you
Yeah.
recommend?
So I tell everybody that I really hope that one day pelvic PT is kind of seen like our OBs are, of, hey, I'm gonna go see them once a year just to check on things and make sure that things are the same as they were last year, or see
Mhm.
how things have changed and what we can do to improve them in this next year. Because as we age, we know that our hormones are doing different things. And when our hormones are doing different things, the tissues in our pelvic floor actually change what they're doing as well. So I'll see a lot of women that are like perimenopause, estrogen is low, and they're like, I now have this dryness, or things just don't feel the same, or I feel my prolapse symptoms more now than I was before. And it's because the drop of the estrogen, the tissues can't support as much because they're not as pliable anymore. So that's one thing. And then like a lot of pelvic PTs have also done a lot of infertility work as well. So there's things that we can do to help you get pregnant and also just educate you on like things that like not the layperson knows. Like, okay, a lot of how your pregnancy is going to go is determined by your partner's health at that time. So, hey, like I need you to like stop drinking so much and I need you to exercise so that I don't have morning sickness for my whole pregnancy and things like that. And we can start getting you as strong as possible. So, preemptively, when you are pregnant and you're not having any issues, we're really like hitting core work really hard so that you have minimal separation once you are 34, 36 weeks. Everybody's going to have separation at 36 weeks just because you've gotten so large at that point. But my patients that come to pelvic PT while they're pregnant recover significantly faster than my patients that only come after. And then
Mm,
also, what we're doing in those last few visits are we're trying the different positions and we're literally going over this is how we lengthen, how we push in these positions. So you feel as confident as possible going into labor. And it's not this is my first time ever trying to do this. And all of these people are yelling at me and rushing me. And I'm just going to listen to what they're saying because
Right.
that's my only what I know at this point. So I encourage
my
everybody to come.
goodness.
Mhm.
That's
That
amazing.
is
I'm
amazing.
like, even if you're like, I just want a practice round, because we'll get people that call us at like 36 weeks pregnant and they're
Mm,
like, I think that I should come to pelvic PT. I don't know if there's much that can do for me right now. Maybe I should just come after. And I'm like, no, like still come in. Even if you only come once or twice, I can make sure that you feel prepared and
Right.
know what to expect. And also we can talk about what I want you to start doing immediately postpartum versus things that you really have no business doing until you're 8 weeks. And
mhm.
I'm seeing patients as early as 3 weeks postpartum and as late as, like, people that had their baby 20 years ago. So I'm like, it's never too late to come, but it's also
Mhm.
never too early to come to prevent these things from happening.
I love
Wow.
that. That makes total sense and is so smart. Well, on a different note, I was just wondering, are there any simple daily habits that people can start doing to support their pelvic floor health?
Mhm. So I would say, like, the easiest one is gonna be, like, taking time every day to try and belly breathe, and when I say that, I really mean, like, 360 breathe or I'm playing with the new term of like globe breathing. Like I want
Mm,
you to imagine like your body is a ball and you're inflating that ball every time you breathe in. So breathing down into your pelvic floor, breathing into your belly, breathing into your back. At first, that's going to be extremely hard to breathe all the way around. But as you do it more, you'll be like, oh, I feel my pelvic floor actually dropping when I breathe in and lifting back up when I breathe out. So that's like a very simple way, one, to soothe your nervous system, and two, to get that pelvic floor expansion that most of us aren't getting because a lot of us just breathe up here in our chest and are never truly breathing down and letting our diaphragm drop all the way to
Right.
get a full breath. So that's like the first thing. And then a stretch like happy baby or frog for a minute or two a day is going to do wonders that you really didn't think that it was going to be helpful, but because they really stretch out your inner thighs. And that's like another place that is usually really tight on patients when I first see them because they're either like always sitting with legs crossed or they're like squeezing every time that they sneeze and just have really overactive inner thighs. And now their inner thighs are working so hard and pelvic floor is working so hard, but nobody's actually doing their job as intended.
Mm,
wow.
interesting. No, those are both helpful
I
for
know. I'm
sure.
like, I wanna go to a pelvic floor
I know.
therapist. I wanna know how to exercise
Well,
and how to move.
when you said the globe breathing, I'm like, who's doing it with you, Ozzy? Because
I
I was
know,
like,
we're breathing.
I'm like, we can do this. I love
Yes,
And,
it.
like, we have all kinds of little tricks because most people do not get it on their first try. So, like, I like Happy Baby because your hips are already in a position where everything is wide open. So, usually, if you take a deep breath and you're in Happy Baby, you will feel like your pelvic floor move. And usually,
wow.
that's like the
Oh,
first time that my patients are like, oh, I've never felt that before. And I'm like, that's what I
interesting.
mean when I'm saying to lengthen. Like, you want to feel that expansion
Mm,
feeling
Right.
in your pelvic floor.
And who
wow.
doesn't like Happy
I
Baby? I
know.
Yes,
mean,
it's
it
so
makes
nice. It
you
helps your back, your hips feel nice.
Yes, when they say that when you're in Pilates, I'm like, "Oh, this
Yeah,
is
we're
the
swaying,
best."
we're
Yeah.
loving it. Yeah,
Oh my
so,
gosh.
I mean, for those who want to come see you, or do you do virtual? Where are
We
you based?
do.
Yeah,
And then my last question is about insurance. So, do you have to get a referral? Those types of
all the
things.
things.
So I've only worked in Virginia and South Carolina. South Carolina is direct entry for the first 6 weeks. So you don't need a referral until like 6 weeks into therapy, which your clinic can acquire that for you if you tell them who your doctor is, or you can send your doctor a message and say, I want a referral so I can go to physical therapy. And I tell people not to ask their doctor, tell your doctor. Your doctor works for
Mhm.
you. If you want to go to physical therapy, there's no reason that they are telling you no. Because
Right.
why are they saying no to something that you just wanna try? It's not a medication. It's not
Mhm.
there's not really a lot of bad, like, outcomes from going to physical therapy. So, I tell people, don't ask for the referral, tell them that you want the referral.
Right.
Virginia is direct access in the sense that we don't need the referral at all. So, you can just call, make an appointment, come in.
Awesome.
We also do telehealth as well, so we can see people that aren't in Northern Virginia that are just kind of scattered throughout Virginia, and we can do virtual appointments with you. We have patients that will do a mix of virtual and in person just based off of where they live or time constraints and all of that. Um, we also are, like, developing some, like, online courses for people that live in other states so that they have access to the information and everything. If they're like, "I'm not sure if I want to, like, commit to going to a clinic near me," or, "I'm not sure if I even, like, have the time to go in person or if that's something that I wanna do. I wanna try this other thing first." So we'll do stuff like that, and I know that there are a lot of PTs that are doing, like, coaching as well, which is still you're still getting the same information, I'll just say that. So, I would say that I would make sure that they are, like, a physical therapist, an occupational therapist, or a chiropractor. Those are pretty much the only practitioners that actually do pelvic floor therapy in the sense that they have been trained to do this in a
Right.
particular way. Sometimes you'll come across doctors that are saying that they have a nurse that does pelvic PT, and it's not typically.
Okay.
Interesting.
That
Yeah.
is interesting.
Wow.
I love
Okay.
it.
Well, thank you so much.
This was
Yeah,
amazing. You're amazing. We're
Thank
so
you.
excited to have gotten the chance to chat with you today. And
I know.
I can't wait for this episode to come out. I feel like our followers are going to be so excited just as we are.
I'm so excited, and, like, all of my patients, they're like, "When are you doing the podcast? Like, make sure you send us the link." So we're definitely gonna put it in our newsletter and everything too,
Oh my
so that people
gosh.
can see it. Because sometimes, like, you hear the information for the first time and you're like, "Okay, yeah, I understand," but you need to hear it a few times for it to, like, really
Right.
make sense sometimes.
Truly,
Right.
I'm gonna listen to this own
I
episodes.
know. I do feel like the way that you share the information as well is so easy to comprehend, especially like
Mhm.
as I said, I am not a wellness girl like in any way, shape, or form. Like I have to hear it from her a million times to be like, okay, fine, that's how I'll do it. But the way that you portray it, I'm like, oh, I can actually do that. That's not scary. That's normal. It's all
Yeah.
good. I love it.
Yeah,
So
squatty potty. We need it.
squatty potty is on my list.
Yes. I that's, like, the easiest thing, and, like, I just, like, keep mine there. They sell ones that, like, fold up, so, like, if you're traveling, you can take it with you, and, like, I get patients that are like, "I can't use the bathroom without my squatty potty now," so they'll be, like, in their friend's bathroom with, like, the trash can turned on its side, like, all kinds of things. I've had patients that are like, "Oh, I just have, like, my bathroom yoga blocks," and I'm like, "What?" And they just keep yoga blocks in the bathroom. So also,
That's
like, use
smart.
what you have. So, like, if you
Mhm.
have a child's stool already, like, in front of the toilet, like, use that. Put your feet up on
Yeah.
that. It's not
Right.
gonna be exactly the same, but it's still going to help.
Right.
Mhm. Well, Amaya, tell everyone where we can find you. What's your Instagram
Your
handle?
socials, all the
Everything.
things.
So you can find me at Ortho Pelvic PT on Instagram, Pinterest, and I think YouTube. And then on TikTok, we're Ortho Pelvic PT1. Our website is orthopelvicpt.com. And we have our chat feature, so you can always go through there to get in contact with us to book. And please don't be afraid to DM me, even if you live in a different state, because we might have options for you. But I also know pelvic PTs all over the country. So I can help connect you with one that's a little bit closer to you if that's something you wanna do too.
Oh my gosh,
You're amazing. Thank you so much.
Yes, thank you.
Thank you
Well,
for having me. This has been great.